Again, hello. Good afternoon, everyone. I would like to welcome you on our live stream topic discussion for today. It's about blood banking. My name is Irene from Infection Control Department and would like to welcome you again, the Team Laboratory Department. They will be with us with the head of Dr. Asana. Okay, let's start. After my topic, it will be discussed by Dr. Asana, followed by Dr. Asana. Okay, and what is blood banking? Sorry, what is blood banking? It's the process that takes place in laboratory to make sure that donated blood or blood products are safe, hmm, before they are used in blood transfusions and other medical procedures. Blood banking includes typing the blood for transfusions and testing infectious diseases. Okay, I mentioned the infectious diseases. This is our topic the last week ago. The part 1, 2, 3, 4 I already discussed. And the part 3 and 4 is the last topic. Now, it's already also included here. But we are focusing now what is blood banking. Okay, let's begin. Okay, blood banking is any patient who is in need of blood transfusion should have blood requests issued by his or her attending physician using blood request form. This request should be filled out completely by the attending physician with his or authorized stamp and signature. Any incomplete information in the blood request is subject for rejection and it should be sent back to the attending physicians for completions. This procedure is strictly implemented in order to have a proper identifications and documentations for the blood being requested. The nurse completes the rest of the blood request form. There must be two staff nurses to verify patient's identity prior to drawing the blood for cross-matching. These two staff nurses will write their names and signature in the space provided in the blood request form. The nurse should provide the following information in the requisitions: patient data. These include the name, age, sex, and what is that's for stand for medical file number, patient locations, test and blood product order, intended date of transfusions, ordering physicians, diagnosis or reason for transfusions, priority as urgent, stat or routine, transfusions history if there is any, specimen collection. Patient blood sample for cross-matching is collected by staff nurse. These patient blood samples in plain red wrap top tube 5 ml in volume. It will be labeled with at least two patient identifiers, patient's full name and medical record number. Barcode is printed from the systems once the order is generated. Pre-transfusions and compatibility cross-match testing. The responsible staffs are the laboratory staff. The laboratory staff who is receiving the requisitions compares the recipient identification level on the specimen with the corresponding blood request form to ensure the information are identical. Cross-matching should be done only after the patient has been admitted. Selections of blood and blood component is performed by the blood bank staff who is doing compatibility testing. The blood bank staff ensures the donor unit identifications is conforming to the intended recipient's identifications and blood order. Donor unit identification level contains the following: name of blood bank facility, name of blood bank facility, type of blood component, ABORHT type, infectious disease testing result, volume, collection date, and expiry date. Expiry date. Only staff, only nurse staff comes to get the blood unit. Requests for release from the blood bank. The nurse rechecks the data of patients and makes sure that there is no discrepancy. Next, the blood bank laboratory technician shall issue only one unit at a time unless the ward has controlled blood bank refrigerator for storage. An exceptions to this would be if two units are being transfused at the same time through two different lines. Appropriate PRBC packed red blood cells units to give ABO compatible should always be given first. Patient type, first choice, other choice. The patient type is 0 and AB. First choice is O, AB, AB. Okay, sorry. In A, it's A for the first choice, and then other choice is 0. In the B in the first choice, 0 other choices. And in the AB, AB is first choice, and the other choice is AB. Okay. Universal donors they can donate to any blood group because they have two A and B antigens. The group A and B individuals are universal recipients. They can receive blood from any group because they do not have A and B, A or B antibodies. These are compatible blood groups in case of non-AB group special transfusion. Patient group, the permissible donor group for red cells, a permissible donor group for frozen plasma. Okay, the blood transport to clinical wards. The responsible staff are the nursing staff who sign out the blood. And the blood staff ensures to maintain the cold chain at all times during transport. Properly insulated blood transport containers are provided and used during transportations of blood. The ice in use, if required, provided by the blood bank should be clean and should not come in direct contact with blood bags. After receiving the blood unit, the nurse should go directly to the patient's area and prepare blood transfusion. The blood transfusion administrations, the responsible staff are the nursing staff and physician. Blood transfusions informed consent must be obtained prior to Transfusion. This is important. This consent should be obtained by the attending physicians with the presence of the assigned registered nurse as a witness who is knowledgeable about blood transfusion and the patient's condition so as to be able to explain the elements of the informed consent. Checking to ensure that the right blood is to be given to the right recipient. There must be two patient identifiers, patient's full name and medical record number, which is your MRN, used when verifying patient's identity. Okay. The blood transfusions administration continued. There will be two staff members, registered nurse and physician, to carry out the identity check of the patient and the blood component prior to administration of blood. Blood transport to clinical wards. The responders are nursing staff who sign out the blood. Okay. Procedure for blood transfusion administrations and monitoring and management of blood transfusion reactions. The blood warmer. All refrigerated blood products should be warmed to 37 centigrade before administration to prevent hypothermia. An approved blood warming device is used appropriately as indicated and monitored by staff nurse so that blood is not warm above 42 centigrade. Once blood is warmed to 37 centigrade, it deteriorates rapidly and should be used immediately. Excessive heating will damage proteins and clotting factors, and it will be but decrease the oxygen, the O2, which oxygen carrying capacity of RBC, which are red blood cells. Take and record baseline observations. What you will be observed, what you will, of course, the temperature, the pulse, respiration, and blood pressure prior to the admission. I remember this when I was in the ward area before. We have monitoring if there is blood transfusions patient. We had to monitor it. We have to be observant if there is a case for blood transfusion. Start the transfusion as soon as possible after the blood components arrivals in the clinical area. Sorry for my voice. I have colds. If a delay is starting the transfusion is likely, the blood should immediately be returned to the laboratory refrigerator within 30 minutes of removal. The transfusion of each unit of red cells should normally be completed how many hours? Within 4 hours of removal of the blood from refrigerator. Blood components must never be stored in a drug or domestic refrigerators. If a unit of red cells has been out of the refrigerator for more than half an hour and there is no prospect of it being transfused, it must be returned to the laboratory to discard, explaining that it has been unrefrigerated for more than half an hour. Medications must never be added to a unit of blood. Yes, of course, must be. Monitoring in care of patients receiving transfusion. The patient should be asked to report any potential adverse effects, including shivering, rashes, flushing, and shortness of breath or pain in the extremities or limbs. Schedule of observations. 1. Record the temperature, the pulse, respiration rate, the respiratory rate, and blood pressure before the start. The first set of observation should be recorded at 15 minutes and must be within 30 minutes after the begin of transfusion. Record temperature, pulse, respiration rate, and blood pressure at the end of each unit. Note that signs of severe transfusions reactions are most likely to become apparent during the first half hour of transfusions of each component. Current transfusion associated risks to patients. Current transfusions associated risks to patient. The bacteria UNM is the most frequent transfusion transmitted infection. New and emerging pathogens are risks that current safety measures cannot eliminate. Leukocytes, residual cells, and cytokines can cause a harmful post-transfusions reaction. The screening limitations, its window period remains a gap and existing defenses. The known pathogens, its routine testing covers only a limited number. In blood transfusion reactions, we have components AFS. What is A? Allergic, F, febrile, and hemolytic. Allergic is mild flushing, hives, rash, severe increased anxiety, wheezing, and decreased BP. Febrile, headache, tachycardia, tachypnea, fever, chills, and anxiety. Okay, remember this reaction. In hemolytic, decrease yung BP, increase yung RR. So, hemoglobinuria and chest pain, apprehension, low back pain, fever, tachycardia, and chills. The transfusion reactions. If a transfusion reaction is suspected, what you will do? First, you will do, of course, you need to contact a doctor immediately and record temperature, pulse, respiration rate, and blood pressure. Further management depends on the type and severity of the reactions. This is the transfusion reactions. If mild, there is facial flushing, hives, and rust. This I already mentioned. In severe, there is anxiety, wheezing, dyspnea, then decrease yung BP niya. It's allergic. In febrile, yeah, headache, tachycardia, tachypnea, fever, chills, and anxiety. Then in the hemolytic, I mentioned yung decreased BP, increased RR, the respiratory rate. With fever and tachycardia and chills. Chills will be she or he will have a chills. Then chest pain, apprehensions. Then there is pain on the back. If you notice this reaction with all reaction, what you will do? Stop the blood. You have the right to stop the blood. Maintain line with NS. This NS, normal saline. That's why you have a piggyback um, for normal saline. If a severe reaction is suspected, stop the transfusion and seek urgent medical advice. Change the giving set and maintain venous access. Said, stop the transfusion and seek urgent medical advice. Change the giving set and maintain venous access. You will only change the giving set, but you will not remove the maintain the cannula. Huh? It must be maintained venous access. That's why it's very important. The reaction must be reported to the blood transfusion laboratory. The laboratory will request the return of the implicated unit and further blood samples from the patient. Record the volume and color of any urine pus. If there are signs of hemolysis, the urine should be sent for analysis. Then observe your patient until hemodynamically stable, recording vital signs. Yan. There is a rat there in this acute adverse reaction for blood grouping, cross-matching, hemoglobinuria, hep, hap, sorry, ASD, total bilirubin, enteric and enteric bilirubin chemistry. Documenting the transfusion. Its transfusions must be documented in the patient's medical records by the medical team responsible for the patient, including the following informations: consent to the transfusion, date and time of transfusions, clinical indication for the transfusion, type of blood component, and the numbers of units transfused, the unit numbers of each blood components transfused, transfusions, reactions, and their management. Fresh frozen plasma, volume 250 ml contain or coagulation factor. And it will be discussed by Dr. This after my topics. The standard dose of FFP is 15 kilogram of body weight for an 80 kilogram adult. This equates to for adults units. Thank you. And the next will be followed, and the next will followed by Dr. Sana. Hello, Doctora. Good afternoon, Doctora. Hello, Dr. Sana. I'm waiting for you, Doctora. Hi, good
Hello,
afternoon, Doctor. Hello,
Assalamu
Doctora. Welcome
alaikum.
to our
Good
Salam.
afternoon.
Salam, Doctora. Good afternoon,
Assalamu
Doctora.
alaikum
Welcome.
wa rahmatullahi wa barakatuh. Good afternoon for everyone, and thank you for your preparation, Erlene, for this lecture.
Yes.
Uh, Good preparation and introduce your lecture is very nice. Now I will talk about the blood banking in the laboratory. It is very multidisciplinary topic. But in this chance, I would talk about production and storage of blood component.
Yes,
Okay,
Doctora. Go ahead. Yes, go ahead,
because it
Doctora.
is first step in the hospital. In my hospital, there is no donation unit. Just the blood unit come from the university or hospital from the hospital governmental hospital. Okay. طيب production and storage of blood component. The objectives of this lectures, you must be able to enumerate changes in blood component during blood storage, identify anticoagulant preservative solution and their functions. Blood component preparation, the last one, number 5, phrases and its applications. Okay,
Yes, Doctora. Go ahead.
as blood is a necessary life-saving therapy, there is a significant concentration towards blood product. A blood product usually refers to a product separated from a single unit of whole blood. We know that the blood consists from several components. Separation of whole blood into its parts allows optimal storage of each part, transfusion of the only required part. We make separation in the lab for the blood unit to each unit because each unit has special storage. For example, you say uh, fresh frozen plasma must be frozen. Blood RBCs or bug cell must be at 2 to 8 degrees centigrade. Each part have a special storage or temperature. And the other reason, the blood component must be, for example, give the patient as need. For example, need bug cell, the patient transfuse just bug cell. Okay,
Yes, Doctora. Yes. The changes during blood storage, Doctora. Yes, alternative in blood storage, which may be appearance includes plus energy with storage time. Exchange of shape to spherical shape as a result of introduced water to the cells. The loss of lipid from the cell membrane. This increased osmotic pressure in erythrocytes as a result of lost transport activity of yes, hello, Doctora, to be continued.
Yes, are
Yes,
you
it's
hear
okay.
me?
It's okay. It's now I hear you.
Okay,
Okay.
right. I will continue. Okay.
Okay, no
Blood
problem.
collection bag. In the slide, blood collection bag. Blood
Yes.
is collected in a primary bag that contain an anticoagulant preservatives mixture, must be contain an anticoagulant, with each attached satellite is sterile and considered as closed system to avoid contamination. This is the types of bag. Number one, single blood bag. This contain a whole blood. Whole blood, this is a single bag. Contain only one the whole blood. Whole blood, all blood that contain um, RBCs, platelet, and plasma, leukocytes. All this bag in one bag. This are called single blood bag. Okay. Number two, this is the whole blood.
You hear me, Doctora? Yes. Hello, Doctora. Continue, Doctora. You hear me? Continue, Doctora. Hello? Okay. Hello?
Can
Yes.
you hear me well?
Yes, yes, yes. Continue, Doctora. No problem. It's okay. Just continue because we lost.
Types of types of the bug, uh, triple bugs. Last one, quarterly bug. The whole blood may be divided into four bags: bugged cell, plasma, platelet, plasma factors. Maybe the one or whole blood may be divided into four components. Okay, this is called quarterly bags. Quarterly bags. Okay, anticoagulant preservatives solution. Put the anticoagulant to prevent clotting and extend the storage of red blood cells. Chemicals. Several chemicals may be added to prevent clotting. For example, dextrose, adenine, citrate, sodium biphosphate. Okay, to prevent dextrose support generation by glycolytic pathway. Adenine act as substrate for red blood cell. A citrate prevent coagulating, and a sodium biphosphate prevent excess drop of pH. Maintain as act as a buffer. Okay, blood component preparation. I'm here in the blood component preparation. Erlene, next.
Yes. Blood component preparation of
Yes,
the present
the
cells.
preparation
Okay.
of components from the original whole blood unit is performed by centrifugation. The main process to separate the parts by centrifugation. This is the main process. Red blood cell settle to the bottom.
Since they are
They are the heaviest component, whereas the platelet
huge.
plasma component remain on the top. On the top we found the الأعلى بنلقى شنو البلازما and the platelet. This is the centrifuge used in the blood bank. It is very big.
Yeah.
It is very big to hold the bag of the blood bank. Oxygen blood product may be divided into oxygen carrying components. This is the RBCs and leukocyte blood or frozen solid red blood cells. Then the platelets product, platelet rich plasma, platelet concentrate may be divided into two types. This is types of platelet. Okay,
Two
plasma.
types of platelets. Yes. Plasma.
Yes, types: fresh frozen plasma, cryoprecipitate, stored plasma. Four types. Okay, leukocyte poor blood. Leukocyte poor blood can be obtained by removing and discharging the buffy coat using simple technique. Inverted centrifugation, then
Yes. Washing the red cells using special infusions filter. Yes, Doctora. We are on the leukocyte for blood. Ay, nahulog si Doctora. Okay. I will.
that should be minus 60 and subsequently be stored at minus 65. This is the frozen solid red cell. Such a technique permits the storage of red cell for up to 10 years. This technique permits the storage of red cell for up to 10 years.
Yes. Go ahead. Continue. The inverted centrifugation, the frozen tau, red cells. You hear me, Doctora? The red cells can be frozen to glycerol, liquid nitrogen. Initial freezing temperature should be 80 centigrade units, can subsequently be stored at negative 75 centigrade. Yes, Doctora? Let's wait for the presence of Doctora Sana. I think it will be just for a minute. Yes, Doctora, you hear me? Continue, Doctora. It's okay.
Uh, can you
Continue.
hear me, Erlene?
Yes, I hear you. Only you lost from the some parts, but you can continue, Doctora. No problem. We are in the placenta red cells on this part. Lucid leukocyte. This is the one you ended. The topic leukocyte for blood. I hear you, Doctora. This topic, Doctora, leukocyte for blood. The leukocyte for blood can be obtained by removing and discarding the Buffy code using simple techniques. You hear me? And then inverted configuration, washing the red cells using special infusions filter. Mm. You lose again? So okay. Hello.
Hello, Zaid.
Yes,
I think
Doktora,
we
continue. No problem. It's
sorry.
okay.
طيب, I will
You
briefly. Okay,
you're
continue.
on the
Okay, can you
leukocyte
hear
for
me
blood.
well?
Yes, yes, I hear you now.
طيب.
Okay, continue. Leukocyte for blood. That's the last one.
Yes.
Yes. Hello, Doktora.
Uh,
Leukocyte, the
Hear
last
me
one.
well?
Yes, yes. Go ahead. Continue.
Poor blood.
Yes.
Leukocyte. Are you hear me well?
Yes, 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 yes. Yes, Doktora. I hear you.
Mm, I will continue. Okay.
Yes, yes. Go, go.
Frozen
Go ahead.
solid red cell. Red cell can be frozen, liquid nitrogen, initial freezing. The red cell may be freezing for minus 80 to minus 65. This
Yes.
permits storage of red blood cell for up 10 years. Okay, so it red cell is used to store the red cell for several years. Platelet product divided into two parts. Platelet-rich plasma
Last one.
is obtained following gentle centrifugation of whole blood. Platelet concentrate,
Concentrate.
it is fresh platelet, another centrifugation. After another centrifugation, this gives us the platelet concentrate, more concentrated.
Okay. Next. Para
Platelet.
plasma
Okay?
products.
Yes, yes. This is the next to see the platelet shaker. Next, Edlin.
Press frozen.
Yes. Next, this must be freeze. Okay.
Frozen plasma.
طيب, fresh frozen plasma is prepared from whole blood within 6 hours of blood collection. Is prepared from whole blood by single heavy spin double centrifugation to prepare platelet at the same time. Start at minus 30 for 1 year. Okay.
Okay.
Frozen plasma is separated from whole blood within 24 hours of collection, stored at minus 30 for 1 year, like labile factor. Okay.
Okay.
Next,
Prior.
cryoprecipitate. What is the cryoprecipitate? Cryoprecipitate
It is produced from freshly
followed by
separated.
thawing
Yes.
at 4 degrees centigrade by centrifugation. Then make centrifugation factor 8 and fibrinogen. Factor 8 is very important for the patient with hemophilia. Okay, it can be stored at minus 30 for 1 year. Stored plasma is the plasma that is separated from whole blood after 24 hours or after preparation of cryoprecipitate, stored at 4 degrees centigrade for 5 weeks or at minus 30 degrees centigrade for 10 years.
2 years.
Okay, yes. This is a summary of the each component and an indication.
The whole blood,
Indication
the
whole
red.
blood. This increases oxygen carrying capacity and plasma volume. Red blood cell increases oxygen carrying capacity and also give for anemic trauma and in surgery. Platelet indication bleeding caused by thrombocytopenia or thrombocytopathy if there is problem in the platelet. Fresh frozen plasma replaces stable and labile coagulation factor. Fresh frozen plasma is very rich with the coagulation factor.
Factors. Next.
Summary of blood component also cryoprecipitate, antithrombophilic factor, treatment of factor 8, and Willebrand deficiencies. Factor 8 is very important for the hemophilia. Leukocyte reduced product, avoid febrile non-hemolytic reaction, and prevent human leukocyte antigen alloimmunization. Red blood cell frozen, rare blood and autologous storage. Red blood cell frozen, autologous, this is types of donation.
Nation.
The patient donor with his blood after he need it also transfused his or her blood return back. Okay, this is the autologous.
Apheresis.
Briefly, we will talk about the phrases. In an apheresis procedure, blood is withdrawn from the donor or recipient and patient separate into components by machine. This
Mm-hmm.
next Erlene to see the picture of the apheresis, the steps. Next, this is the principle.
Yes. And next, what's the
Okay.
one?
Next, this is a picture. See the phases. Donor first
Donor.
blood is drawn.
Drawn.
Yes.
And
Number
then
two, blood is separated into
separated
component
into
by centrifuge.
centrifuges.
Number three, needed component are collected into sterilized. If
Bags.
needs a platelet, yes. If needs a platelet, we separate just the platelet from the patient and return back the blood to the blood donors after take the platelet. If need the RBCs, take the RBCs and return back the 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 other component of the blood. This is the called spheres. Okay.
Uh,
What is the uses of or applications of the spheres? The use of phrases technology can be divided into two categories. Component collections, to collect the component, okay?
okay.
Because mentioned previous or from the beginning of the lecture, each the part or component of the whole blood need a temperature or a specific temperature for storage. Okay, the other application for therapeutic procedures. If the
Procedures.
patient needs a blood platelet, take him the platelet just. This is the other application. This is the reference of this lecture. Thank you for your attention. When you give money, but when you give blood, you will save a life. For this
Yes. But
reason,
when
transfusion must be done in safe and in quality
yes,
procedures.
procedure. When you give money, you may.
Next lecture, we talk about the policies and the procedures for the transfusion and steps of the transfusion by the safe and quality. Okay, thank you for
Okay.
your attention.
Thank you, Doctora, for the participating our lecture for today. Though we have some interruptions to the connection, but it's okay as long as we
Yes,
continue
I'm
for
so
the
sorry. Yes,
yes. We don't. It's okay, Doctora, because sometimes connections get
thank
poor.
you.
Okay, Doctora, no problem. Thank you, Doctora, for the
Welcome.
good topics for today. And since the other stuff did not, and for policy and procedures that the doctor Sana mentioned from the laboratory department, it will be come out. It will be present next week. Thank you much, Dr. Sana. Again, um, we do appreciate your participation for today. On behalf of the infection control team. And this blood banking is very useful on the part of laboratory staff. So I already also invited some staff to be with us today. Maybe they are shy, but supposedly they will be here. They will be able to discuss also and participate, but it's okay. They may be not yet ready. The other stuff will. Anyway, this is our time for blood banking. It's very important, especially if there is some case patients need a blood transfusion. Huh? What I mentioned for the last uh, the topics that I mentioned in my PowerPoint presentations. And as I told you, if there is any questions or other you need to know about the information, I have references that I put on my description box down below, and you can browse for it. Even students can help photo for the explanations. Who is the most important personnel that I mentioned on this topic is number one is the attending physician, nurses. It's a collaboration team with the laboratory. That's why Dr. Sana give you some points for the topic discussions. This is our consultant of our laboratory. And then supposedly we have also a microbiologist to be with us, Miss Facha. She is the representative of infection control on the department of the laboratory. And thank you for always updating regarding your communicable cases. You're always submit your cases, and I think I think you are always and bring your logbook in my office, and I just sign for it, and then and of course this must be it's a daily. It's one part of this is the one part of our epidemiological investigation on the part of laboratory and infection control regarding cases of communicable diseases. And thank you, Ms. Vaja, and for the updates. And continue, and don't forget. We have case last other day, and I signed for it for your logbook. Just keep your logbook. Keep your logbook validated and inform us. And that's all for today for our topic discussions. Thank you, viewers, for attending for this topic today. And a shout out to Hashim Umar for some shout out. And that's all for today. Hoping to see you on my next topics discussion. Um, for additional, by the way, I have some premiere vlogs that it will be scheduled uh, after tomorrow. We go to discrimination and then we there, and then I will show you with my some of my colleague here. Thank you guys for watching today. Thank you so much.